Hi, all of you. Today I'm talking on a little different aspect of the health. And when you're approaching a doctor, you'll have some very basic questions, which most of you may feel questions to ask to a doctor. So what I've done today is I've picked up some of the most common basic questions which every patient will have in their mind before reaching a doctor or getting treated for them. Here I am, Dr. Vijaykumar Bada, Clinical Director and Senior Consultant of Surgical Gastroenterology at Yashoda Hospital, High-Tech City, Hyderabad. One common question would be, can we remove just the gallbladder stones and not the gallbladder itself? When you have visited the doctor, he would have told you that your gallbladder must be removed and not just the stones. So you will have a question, why not remove the stones when stone is the problem and not gallbladder? The simple answer is that the gallbladder stones are formed because of a problem in the gallbladder. There's a problem in the wall of the gallbladder which forms these stones. It doesn't keep the bile which is to be stored in the gallbladder in the nature of the bile, in a liquid bile. It forms a small condensation, then it forms a sand-like particle which we call sludge, and then this sludge goes on to form stone. So just imagine that if we have a treatment where we can only remove these stones, the stones will form again. So you should not go for a temporary fixation of your problem when you can actually, assess the problem at the root. So that is why removal of the gallbladder and not just the stones is the best treatment available. Does removal of gallbladder affect my digestion permanently? Definitely not. Gallbladder removal doesn't affect your digestion permanently because the function of gallbladder is to store the bile which is produced in the liver. Whenever there is requirement of this bile juice into the intestines, the gallbladder releases the juice into the intestines, the digestion happens. But once your gallbladder has formed stones or sludge, the gallbladder is not functioning as properly as it should. So removal of the gallbladder will not cause long-term problems. The liver will automatically take up those functions of the gallbladder. So if at all, there could be a small digestion issue in the first 1 week after surgery, but beyond 2 weeks after removal of the gallbladder, none of the patients will have any permanent problem. Then another question is in a bariatric surgery. It's a very common surgery now. Most people are opting for bariatric surgery to improve their overall health. Where does all this fat go after undergoing a bariatric surgery? So obviously, it's a very important question. We do a bariatric surgery, we know that your weight comes down, but where does this fat go? So actually fat is nothing but deposition of the extra calories or energy in your layman terms that is accumulated in the body. Because we haven't burnt it enough, the body is converting them and keeping it as fat. So once you undergo this bariatric or more appropriately a metabolic surgery, as your weight goes down, body replenish or uses this fat for the effective functioning of the body, and the fat gets dissolved on its own. It is absorbed within the body. So that is how a fat gets dissolved. That is why after a bariatric surgery, it is not a sudden weight loss. It's a gradual weight loss over a period of months. So as and when the weight loses, there is more fat which is there in the body is getting readjusted, redistributed into the body. So that's how the fat gets dissolved gradually after undergoing a bariatric surgery. Next question, is bariatric surgery only for people who are lazy or overeating? So, because many people think that I've eaten enough, I don't have control on my food, I've eaten a lot of junk food, I've gained weight, now let me get a bariatric surgery and lose all that weight and probably let me see how it goes later on. So ideally, it should not be there. If your weight gain, excess weight gain, overweight gain has only been because of your laziness and overeating, I think you should try to lose your weight by diet and exercise only, because if you have gained that, you can easily lose that by these measures. But most of the patients who are overweight, obese and different types of classes of obesity, they have associated problems in terms of hypertension, diabetes, excessive snoring, sleep apnea, the osteoarthritis and various other problems. These are all called a metabolic disease, a metabolic syndrome. It is not just weight gain, but they have all these other problems. So we are usually interested in offering treatment, surgery for those patients who have more of these associated problems. It doesn't mean that if you do not have any of these problems, you should not undergo a bariatric surgery. Yes, you should undergo a bariatric surgery, but you should keep in mind that you should have a better control on your diet and exercise. Because if you are, say, around 40 kilos more than your ideal body weight of 25-30 kilos more than an ideal body weight, and you have tried enough measures by diet and exercise to lose your weight, and if you have not been able to reduce the weight, yes, opt for surgical treatment, reduce your weight, come back to your near to ideal body weight, and then start maintaining discipline in terms of lifestyle changes. That will help. So bariatric surgery is for anyone and everyone who is obese and who fits into a surgical criteria to undergo a surgery which will benefit him or her to improve his overall health and well-being. The another question is, after undergoing a bariatric surgery, can the stomach grow back? In the sense that stomach is an expandable organ. You know that in normal human beings, all of us also, stomach is collapsed. As and when we eat, the stomach increases. It has got a capacity of 2.5 liters to be in common terms. So that means if it can accommodate 2.5 liters, that means the stomach can increase in size. In a bariatric surgery or metabolic surgery, one of the procedure is called a sleeve gastrectomy, which all of you will be aware of. In that procedure, we reduce the size of the stomach. This big 2.5 liter sized stomach we reduce into a small tube so that the quantity of intake is reduced. But because it has this expansile capacity, expansile nature of the stomach, there is a small possibility that the stomach can slightly increase in size over a period of years after the bariatric surgery is done. That is why whenever any patient is undergoing a sleeve gastrectomy, we tell them that first 1 or 2 years there will be very good control, because the stomach wouldn't start increasing immediately. If you start overeating, if you start faulty lifestyle habits after 2 or 3 years, yes, the stomach, we have seen that some patients' stomachs have increased by 10% or 20% or 25%. So we have seen that patients have lost weights very significantly. They have come to their ideal body weight, and then they have started gaining 5 to 10 kilos after 3 or 4 years or 5 years after the bariatric surgery done. This usually happens in those patients who have undergone. But in other types of surgeries, like different types of bypasses, the capacity for the stomach to increase in size is very, very, very minimal. Only in sleeve gastrectomy there is a small possibility that there could be an increase in the size of the stomach after a few years after the surgery. One more question is about the robotic surgery, which is the in-thing, the most advanced type of surgery, the latest advancement in the surgical techniques to make it more safer and less painful. So, but the biggest myth most of them have is that when you say robotic surgery, surgery is done by the robo or by the surgeon. Robo does everything? Because we know there are robos in many other fields, like day-to-day activities in some of the in the airport lounges. We see that the robots are taking up most of the common work. But in surgery, it is not. Robo never has the capacity to do a surgery. A surgeon does the surgery, robotic surgery. We only use the robotic technology to make the surgery safer, more precise, and more simpler. Robo doesn't do a surgery. Robotic surgery is only adapting a robotic technology which gives increased precision, reduces the blood loss, and makes the job easier. So please do not think, because I have had patients, because we do the highest number of robotic surgeries. So patients come and we offer them robotic surgery. Say, sir, actually I came a long way thinking that you will do a surgery because you are a better surgeon, but now you are telling a robot does the surgeon, I'm not comfortable, so you only do my surgery. So please have it in mind that robo is not in a position to do surgery, and in the near or later future also, you won't have a robo which will operate on its own. You always have to have a surgeon who operates the robo, and that does the surgery. Another thing is, one more very important question is colonoscopy. Whenever we ask a patient to undergo colonoscopy, their first thing is they are scared. Is colonoscopy bad? Is colonoscopy risky? Is colonoscopy very painful? Colonoscopy is one of the very important tests to identify many of these things which may crop up later in your life. In most of the countries, colonoscopy is a routine screening test to identify tumors or cancers. But colonoscopy is not just done for cancers. For various other reasons, we need to do colonoscopy. And let me ease your fears by saying that colonoscopy is a very, very simple test. It is not painful. It is there's no discomfort in that. Yes, some of the colonoscopies are done without anesthesia, without any sedation. So there you might have some amount of bloating or tummy getting filled while doing the procedure. But if you want this test to be done under mild sedation or anesthesia, it can very well be done without any risk. So colonoscopy is very safe to get it done even with or without anesthesia. Most of them off late, request for some amount of anesthesia, and that will be very minimal anesthesia, and immediately after the colonoscopy is done, you are awake and in 2 hours you are going back home. So if you are advised a colonoscopy as part of a screening or as part of a therapeutic test or as part of identifying the problem, do not shy away from getting a colonoscopy because it is painful or it's very scary. Okay, please go ahead and get a colonoscopy done. Just ask before you get the procedure, ask your doctor how comfortable it is. Is he comfortable using anesthesia or you want anesthesia? Otherwise, you can opt for colonoscopy to be done as it is. We have touched upon some of the most common problems and the basic questions. Thank you very much. Have a good day.